Pacifiers cause harm, true or false?
Well, this one depends.
Hi, I'm Sarah and welcome to Little Nutshells, a YouTube channel for new mamas exploring all things baby and toddler. And today I'm joined by Dr Kiran Arora, family dentist and surgeon with over 12 years experience and a mother of 3. Today we are debunking myths about toddler teeth, so let's jump in. Okay, so first myth. Milk teeth don't matter, true or false?
Absolutely false. Milk teeth are so essential at holding the structure of the face. They're really important in helping the adult teeth come through in the correct position. Without the milk teeth, children are not able to eat, they're not able to get the right nutrition, and essentially they can't even learn to articulate their words. So absolutely wrong.
Now for the second myth. Teeth are bones. Is this true or false?
Well, this one is actually false. A lot of people assume teeth are bones, but they're actually considered to be organs. They're a group of tissues working together to perform a function. So no, they're not bones. They have similarities to bones, but they're not.
So moving on now to myth number 3. I am super curious about this myself. Pacifiers cause harm, true or false?
Well, this one depends. So if they are used for extended periods of time, then yes, the American Association of Pediatric Dentistry do say that after 18 months, you do notice changes in their oral facial development. So ideally, you want to start weaning babies off the pacifier from around 6 months, which is around the same time their teeth come through and they're starting to move on to solids.
Flossing and mouthwash are essential for oral health. Is this true or false?
I have to say this one is false. So I don't recommend flossing in children. I know some healthcare practitioners do, but if it's not done correctly or if the child's moving a lot, it can actually cause more harm. Mouthwash, no, I don't recommend this for kids. I definitely don't recommend it for adults. Kids, they just would end up ingesting it. And for adults and children as well, it just disrupts the oral microbiome and actually causes bad breath long term.
Really?
Yeah.
I didn't know that.
Yeah, a lot of people don't know this.
Yeah.
And actually, when you break it down, a lot of mouthwashes used to contain alcohol. So this disrupts all the bacteria in the mouth, and we need a balance of the good and the not so good bacteria to have a healthy mouth. So if we're using mouthwash to remove all the bacteria, we are predisposing ourselves to bad breath long term, amongst other issues.
Next myth. Fluoride is harmful. True or false?
Oh, Sarah, this one is always a very controversial one. Now, fluoride has been recommended by dentists and healthcare practitioners for years. And the reason this is because it helps promote remineralization of the teeth, protecting the teeth against cavities. Now, what I would say is if you do have any concerns over fluoride, then do consider an alternative ingredient, and this would be something like hydroxyapatite. So this is what I usually recommend my patients to use when they have a concern with fluoride.
And what about children swallowing it or ingesting it? Is that okay?
They definitely should not be ingesting large amounts, and this all comes down to the amount of toothpaste that you're applying to the teeth. So there are health risks and health concerns if a child was to ingest a whole tube of toothpaste, but hopefully that won't be the case. If a parent or whoever is helping the child to brush their teeth, if they just ensure that they're squeezing the most smallest amount, and there should be a smear amount for a child under the age of 3, which is the same size of a rice grain, or a pea-size amount if they're over 3.
Children should brush their teeth straight after a meal. True or false?
False, Sarah. So we often associate brushing teeth after meals, but actually this causes more harm long term. We know that once we've eaten our food or we've ingested a meal, our mouth is in an acidic environment, okay? So if we brush our teeth immediately after having a meal, we're more likely to be brushing these acids into our teeth, making our teeth more likely to dissolve. So the recommended amount of time to wait is actually 30 minutes after you've had a meal.
Okay, great to know. What about toothbrushes? Electronic better than a manual toothbrush?
True. So the research does support electric toothbrushes are better. Okay, we just are not able to replicate those many rounds or strokes per minute that an electric toothbrush can do, provided they're used properly. So for children, they can use electric toothbrushes providing their manual dexterity is at the right stage. So I usually tell my patients, if your child is able to handle scissors, they probably can handle an electric toothbrush safely.
And last question, sugar-free drinks are better, true or false?
False. So although sugar-free drinks don't contain sugar, they tend to be very acidic. So this still causes issues with the teeth. You can get enamel erosion and you can still develop cavities as a result of these sugar-free alternatives.
So what about putting lemon into water and drinking that with our children?
That's absolutely fine. Lemon water actually has lots of health benefits. Provided you're not drinking it or sipping it slowly throughout the day, then yes, that might be an issue. But we're really referring to the drinks that you buy over the counter or that come in cartons or cans. We want to avoid those processed drinks.
Amazing. Thank you, Dr. Kiran. I hope you enjoyed that. If you like these kind of videos and you want more of this, do let me know in the comments. Now you've heard the myths debunked. If you're interested in hearing more about toddler teeth, you can watch this little nutshell also with Dr. Kiran Arora. Thank you so much for watching. Have a great day.